A warm welcome to Healthy Living with yours sincerely, Oluije Oyukokai. Today on Healthy Living, we'll be looking at asthma care, closing the gaps in access and awareness. And to do justice to that for us is the person of Dr. Ibifiri Omoage. She is a consultant pulmonologist, respiratory unit, University of Benin Teaching Hospital. Good afternoon, Doc.
Good afternoon, all. Thank you for having me.
Okay, now it's known that asthma is a chronic lung condition affecting over 260 million people worldwide. Now, is this a decline in the rate of persons that are being or come down with this disease? Is this a decline or an increase?
So I think I'll start by
Looking,
saying,
looking at the studies right now before we dive into the meaning of asthma.
well, current updated studies even say it's over 300 million.
Wow.
And then by 2025, that's this year, we expect
Yes.
it to be almost 500 million. So it's going higher, way
Okay.
higher than we expect it to be.
Okay. So on the 6th of May,
Yes.
yes, World Asthma Day was celebrated. So to say that this is something that we need to take very, very serious. You need to know what actually happens, how it happens, and yes, when it happens, what are you supposed to do? And that's the reason why we have Dr. Bifiri with us today in the studio. So first off, what is asthma?
Okay, so to make it easier for us to understand, asthma is a chronic inflammatory airway disease. Chronic means it's a long-term disease, okay? So it's a chronic inflammatory airway disease characterized by symptoms of cough, chest tightness, difficulty in breathing, and wheeze. Now, these symptoms vary over time and in severity. So it may be very severe now, it may be less, things like that. And then associated with airflow limitation. And this airflow limitation may now end up becoming persistent. So that's why we say, oh, if you don't take care of your asthma properly now, it can become a persistent problem later on. So initially it starts by being variable and then it can become persistent. So that's just the summary of what it is.
Okay, now we're looking at global infection, global issues, and looking at it locally. Now, within your own conference, the research that has been done, are we saying that this cry in the stoppage of persons knowing what to do at a particular time, it's going on a far-reached process?
Well, I would say we're still lacking behind in the sense that the positive end is that the positive part is that more people are beginning to seek
Get
proper
awareness.
help. And so with the awareness, I think we are beginning to reach more people. But on the other hand, there are still a lot of people that still have no idea what this illness is about. Some people think it's spiritual. Some people think, oh, it's just something that you treat and you're done with.
Yeah.
So the knowledge is not completely there. That's why we keep raising awareness. And Gina and with WHO have made sure that yearly, the first Tuesday of every May in the year, we should mark this World Asthma Day to create awareness so that more people will know about it and to know that there's actually treatment. Yes, it may not have a cure per se, but treatment modalities are available. And then for this year, the theme is making inhaled treatment available or accessible to all. So we're just trying to say that, of course, the guidelines are becoming more flexible, and so we use inhalers, and we want people to know that these inhalers are effective and are beneficial, and then for support from government to make them at least a bit more affordable and accessible. At least people in the rural areas should be able to get them.
Yeah.
Now, one of the challenges may be for those who are on insurance, NHIS and all that. We notice that some of them do not cover these drugs, and if they can be covered, they'll go a long way. So the main aim is to create awareness and then to ensure that these inhalers are accessible to everybody that needs it.
Okay. All right, so let's look at the symptoms of asthma, what people
Yes.
should look out for.
Okay. So, like I said, cough, chest tightness, difficulty in breathing, and wheeze. Now, for this cough,
Mm.
the cough is usually, of course, chronic. So
Okay.
someone may just, there are some people that just have only cough as a symptom.
Yeah.
So they call it the cough variant asthma. Now, they will take antibiotics, take various types of treatments, cough syrups and the likes, and then there's no cure. And then by the time you now probe further, you actually find out that this cough comes with other complaints.
Mm.
Difficulty in breathing. Of course, especially most complaints will tell you, I cannot breathe down. I cannot breathe down. That's the usual
Yeah.
layman terms we get to hear. Then the chest tightness, it feels like there's a band around the chest wall. So that makes it more difficult
Difficulty
to
in
breathe.
breathe.
Yes. And then the last thing, the wheeze. The wheeze sounds like it's like a whistling sound.
Mm. Mm.
So like a musical sound, which is heard most times when they are breathing out. But it can be both ways. It can be heard while taking in air. It just shows that the airway is narrow, is tight at that time. So that's why the air it comes with a sound. So those are the four major symptoms. However, asthma comes with um, other conditions, I would say. So atopy, there's something we call atopy when people are allergic.
Yeah. To a particular
Now,
thing.
yes. So now, the symptoms you look out for, apart from these four major symptoms I've talked about, you ask about tearing of the eyes, itching of the eyes. So there are some people that just have these red eyes. You just see that their eyes are almost never white. People that have catarrh almost all the time. Those are allergic symptoms. People that will tell you, if they are sweeping this place now, I'll just start sneezing.
Yes.
For some people, the skin rash, we call it atopic dermatitis. You have some rashes at some particular parts of the body. When an asthmatic when somebody is coming with asthma symptoms and then these other symptoms are there, you should highly suspect it's likely asthma. Then there are some other conditions. I'll just talk about the one that killed our former president. It's a rare name, Chuck-Strauss syndrome. It comes with asthma, but there are it's an autoimmune condition where the body fights itself. So like I said, there are other symptoms to look out for. Rash on the skin, rhinitis as catarrh, itchy of the eyes. Yeah, so there are a whole host of others. That we look
Okay,
out
now
for.
someone that lives or has a daily routine, how would you say the person's lifestyle should be with one that has asthma?
Okay, so for those who have asthma, the advice is, as long as you're doing the right thing, you're following your treatment modality, which is given, or asthma action plan, which the doctor would plan out with you, you should be able to identify the triggers. Now, not everyone has the same trigger. There's some people that will be able to tell you where they are sleeping, I can actually stay there and nothing will happen. But when they go to maybe a place where people are smoking, or somebody sprays a particular type of perfume, they just start having asthmatic attacks. So we advise know your triggers and avoid them. What are the common triggers? Dust. Dust is actually the mites, the feces of the mites in the dust, so that serve as the allergen. So we just say avoid dusty areas, avoid where they are smoking, cooking with maybe firewood, a lot of smoke. Can be smoke fumes from vehicles, it can be somebody smoking cigarettes. Then there are some particular for some ladies, we say wash your wigs frequently because of the trapping of the dust, your beddings, the bed sheets, pillowcases, the curtains. If there's a rug in the house, it's advised to remove. Now, pets, even the body of the pets can carry some allergens. So people that have cats, dogs, you want to avoid too much of contact with them. Then for those who fry, the fumes from the frying can actually trigger stress, extreme emotions, cold air direct inhalation of cold air can actually trigger it as well. So the major thing is know the triggers and avoid them as much as possible. There are some that are unavoidable. For example, infections of the airway. They are really, well, as much as possible, we say vaccination. For those that cannot be avoided, you treat in time to prevent worsening of the asthmatic symptoms. So there are a host of others. For those who work in, so now for the question you asked, for those that work in maybe a place like a cement factory, we advise them to stay away or use personal protective equipment, put on the face mask and things that will help to prevent direct exposure to the dust. so that it doesn't worsen the asthmatic symptoms and then make the illness progress.
Okay,
This
can
just
one's lifestyle attract asthma into someone's life?
okay. So, well, I would say yes.
Okay.
Yes, because asthma is not just a genetic. We've moved past where we say there's just genetic predisposition.
Yeah.
Right now, there's something called obesity-related asthma. So people that are overweight are coming down with asthma as well, because the fat cells produce a kind of hormone that ends up causing airway inflammation and then the symptoms as well. So yes, lifestyle modification has to come into play, because of course if someone is eating excessively fat and all that, you end up getting fat, you end up having asthma. Then there are some foods that some people are allergic to which can trigger asthmatic attacks. For some people, they'll tell you nuts, groundnuts. For some people, there's some kind of fish like tuna fish for some people. So all those things can trigger of course, asthmatic attacks in them. So you want to avoid those kind of. So yes, lifestyle, then occupation. So for the occupation is both ways. There are some things that would sensitize the airway. There are some things that would irritate the airway. For the sensitizers, they may not necessarily have the symptoms immediately. It may take years. They will tell you, oh, 8, 9 years ago, I was working in so and so factory, but it's now they're having symptoms. For those that are just irritants, it can happen. Maybe they just close from work, they start to have symptoms. So yes, some kind of jobs can predispose, but it is worse when the person has that genetic predisposition.
Okay.
When the person already has that, maybe like the father or the mother has asthma, they have the genes that still carry, yes, and then for those who are allergic already, so it worsens it. But for some people that are otherwise healthy, well, it is not as such, but then yes, obesity, occupation can also be a factor.
Okay, so in general, lifestyle also helps to trigger asthma. Okay, now let's look at parents. You know, kids, especially kids from 2 years. Okay. And that brings us to this question now. How young can someone be? From what age can one say, oh, this person can come down with asthma?
Okay, so in fact, I will just talk about the fact that we had a conference recently and we listened to someone who said she diagnosed a baby at 8 months.
Wow,
with
8 months.
Yes, so it can come very early. Now, the challenge in children is that there are other airway illnesses that mimic asthma. So most times you work with the symptoms, and then children cannot necessarily do those maneuvers. There's a particular test we do called spirometry with reversibility. Okay, so that test needs to be done with some form of skill, and then a lot of we don't even do it in children. So we depend more on clinical management and clinical judgment. We use our clinical judgment to diagnose basically. Now for children, like I said, a lot of mimics. So you need to be, the history would give you a clear picture.
Okay,
and that will come from the parents. So the parent has to be very sensitive. Number one, cough. Children come down with cough a lot.
A lot.
And then if you just take it lightly, so what we advise is that once this cough is not going, first week, second week, they should seek help immediately, because it can be something else. This wheezing is so common in children as well. But like I said, it comes with other illnesses too, so you need to be very sure. And then the difficulty in breathing. A 2-year-old may be able to tell you, Mommy, I can't breathe. But a baby, you will just be able, your observation will be the key there to be able to tell. And by the time the doctor examines and then follows the other associated symptoms and all that, you'll be able to tell, okay, this is asthma, but it is quite difficult to actually diagnose in children. Okay. Treatment-wise, they also do well, as long as you are sure of as long as the diagnosis is correct. Children do well on treatment as well, so it is possible to diagnose them from a very early age.
Okay. So are there any health programs working towards care of asthmatic patients?
Okay, so at the moment, we have, like in our clinic, we have an asthma clinic, which we have a group where we try to bring the asthmatic patients together.
Educating them.
So we have a WhatsApp group as well. Once in a while, we have programs which we call them in to update them on treatment modalities, try to also follow up properly and they also help with the awareness as well. So yes, we have in Benin, but we are still working on making it better, and of course involving government and other non-government organizations as well to join in to at least make this menace of a disease to conquer it in as much as possible. So
Okay.
yes, we have
Okay.
some.
Okay. Now you just made mention of government. So what's the responsibility of government in all of this? We hear a lot of persons saying the drugs are expensive, the inhaler is expensive. So what's the role of government in all of this?
Now it's just to help in subsidizing the medications. One of the challenges was that, or rather, is that the companies which were initially stationed in Nigeria, they had their at least major head offices in Nigeria have decided to leave because of the um,
The economic
economic
downturn.
downturn. Exactly. So this makes importing the medications much more expensive.
Yeah.
And now the government can play a role by helping to bring back those that can come back or subsidize them. And for those, that's for those paying out of pocket. And for those who are on insurance, NHIS and the likes, we're hoping that they can have their asthmatic medications as part of covered by the insurance. This will go a long way in encouraging the patient as well to even stick to the treatment plan. Like I said, the treatment is now becoming more flexible. So the guidelines, like I said, is becoming more flexible. Initially, we'll say, okay, you should have your 2 inhalers, one for your morning routine, morning, evening, the other one for emergencies. At the moment, there's a guideline that uses just 1 inhaler for both, making it, at least you don't have to end up buying 2 different inhalers. So all these things make it better and easier to handle. So we are just trying to plead as well as appeal that the government helps to make it better and subsidize this cost of medication so that people can buy and afford them.
Okay, if you just joined us, this is Healthy Living, and we're looking at asthma care, closing the gap in access and awareness. Now, when we return, we'll be talking more on accessibility and how awareness, how far it has gone. Now, those in the rural area, what are the outreach that government or organization are taking to make sure that this cry is being heard everywhere? So don't go away, don't touch the dial. I'll be right back. All right, many thanks for rejoining us. Like we did say before we went on a short break, yes, let's look at accessibility. Lots of persons are saying the access to the drugs, the inhalers, are not as there as it used to be. Now, you did make mention of the companies that used to provide for all of this. Apart from the companies, now, do we have other organization, other persons that can actually come to the aid of these persons?
Well, sadly, at the moment, for free treatment, we don't. And that's part of why we're trying to create this awareness so that people in the rural areas can still have access and knowledge about this illness. Secondly, we're also trying to see how we can reach out to health workers in the health centers, because it shouldn't be at every slight provocation one is running to UBTH, one is running to Central Hospital. Some of these attacks should be able to be managed at the primary health care centers. So one of the aims for this World Asthma Day was also to reach out to some of those health centers to also train them, do some step-down training to see how they can also have more knowledge on the management, as well as reaching out to the communities there. So that's the little we can do in our own way, and necessitating us calling on the government as well to assist. It's really not easy handling all this alone. We get some support from some companies, like the drug companies as well, but it's really not sufficient at all to get towards those people in the rural areas.
Okay. All right. So quickly now, before we will go, let's look at are there misconceptions that people have about asthma?
Oh yes, there are. Some people feel it's spiritual till tomorrow. There are some people who just feel, oh, this attack is a spiritual problem. In fact, some people go as far as burning the feet and bodies of the patients just because they feel, oh, this attack must go. Some would say they are flogging the person, pour water, things like that. So that's one misconception. Secondly, some people would say because she's asthmatic, because this family or they're asthmatic or they
Yeah.
don't go close to them, or if you catch them because you want to associate with them, things like that.
Stigmatization.
Stigmatization is a problem. So it also makes people not even want to use their inhalers outside.
Yeah.
They'll tell you, oh, I can't carry it in my handbag. People will laugh at me. I had a student recently in the hostel who did not just want to tell her friends or her roommates she was asthmatic, and then they were cooking in the room. So things like that. So stigmatization, asthma is not a spiritual problem, and you should worry about your health first before thinking of any other person worrying about you. That's why I try to tell people. So this stigmatization is really a major problem, but it's something that can be handled. We keep talking to our patients, we keep telling them, forget about what people think. If you cannot breathe, if air cannot get into your lungs and
There's
into your
hardly
body, your
nothing you
brain,
can do.
within
Yeah.
3 4 minutes you're gone. Brain is gone.
Yeah.
So it is better to care for yourself before thinking of what people
Others.
would think of
Yeah.
you. So
Yeah.
we encourage people not to allow stigma be a problem. We also try to tell people, so there's some people that come with their spouses just for advice before getting married. All we say is, as long as you have your asthma action plan, follow up with your doctor, and then if you have emergencies, seek help. All those things are clearly spelled out.
Okay.
Secondly, watch out for your kids, because like I said, there's a genetic
Yes.
predisposition,
Yeah.
so you must watch out for those, your children, and then pick symptoms in time so that management can start in time. Remember, the first thing I said was that this problem can become persistent. The airflow limitation can become persistent, and in the long run, it can now have other negative effects, which would come with what we call COPD, can have effects on the right side of the heart, and many other complications.
Okay.
So we want to prevent all that.
Okay.
by
Okay, quickly
treating in
now,
time.
for someone that's just been newly diagnosed with asthma,
Yes.
your advice quickly.
Okay, so first of all, if you're newly diagnosed and you have seen a doctor,
Yeah.
just stick to what the doctor has told you. Know your triggers, avoid them, use your inhalers properly, avoid the things that will trigger them, and ensure appropriate follow-up. If you haven't seen a doctor, I would advise you seek proper counsel, because it would help you live a normal life in long run. Thank you.
All right, thank you so much, Dr. Ibiferi, for taking out time to come educate us as far as asthma care is concerned. Remember, health is wealth. Now, like she did say, the signs you should know: tightness of the chest, persistent coughing, itching eyes, and running nose. See, you need to run fast to go see a doctor. To be seeing you again next week for another exciting time on Healthy Living. To have yourself a blessed day. Bye for now.